So good afternoon guys. Today we'll discuss about one important condition, and the rarest presentation includes carcinoma of the cheek. So this is very common in the Indian group because Indians are prone to have more tobacco chewing and more betel nut chewing. So because of this condition there will be more prone to have some carcinoma of the cheek. So in this patient, she is a 45-year female patient. She is present with complaining of this ulcers. So she developed this ulcer since 4 months. So since 4 months she developed mild. First she developed some ulcers, and later on it will destruction of and losing and destruction of the self skin. So now in this presentation she came to hospital. So we'll discuss about what is meant by carcinoma of the cheek and how it will form and how it will spread and what are the clinical features, what are the treatment modalities that are applied in the case of carcinoma of this cheek. So carcinoma of the cheek is a broad term, so which includes there are many forms of the carcinoma. Either it may be papillary carcinoma, either it may be squamous cell carcinoma. In this patient, we will discuss first clinical features. What we will discuss is you can see any ulcers. What are the criteria that ulcers which are having cancerous ulcers? There are some ulcers. It may be cancerous ulcer, normal ulcers, and the tubercular ulcers. These are the three major ulcer which we have to keep in mind. So tubercular ulcers are having some criteria, and in this patient she is having cancerous ulcers. Oh, this is also having some criteria. So we will discuss about first we'll examination and the clinical features we'll discuss, and after that we'll discuss about the pathology and everything. So you can see this. First, there is no shape. You can see this irregularity of this ulcer growth. You can see this, and you can see the from inside also. You can see she is unable to open the mouth because of this mass, and you can see this induration. So with this induration and because of the unshaped ulcer formation, she is having this secretion from the mouth, saliva secretion. There is no any secretion from these ulcers. So any ulcers which, if it is a carcinoma of cancerous condition or any carcinoma condition, it will develop some painless condition. If it, just assume what are the differential diagnosis in this condition. First, differential diagnosis includes either it may be cellulitis, either it may be any bite that will form again a cellulitis. So how to differentiate means, in patient of any CA patient, they will present CA ulcers. Firstly, they will present with the soft painless ulcers. So it may be a growth or anything. First, they will be present. You just think that this is an this is ulcer. First, she will develop some soft, painless, non-indurated growth. So what mean by soft, painless, non-indurated? Pain, if it is a pain, redness, everything, it maybe goes towards the cellulitis with acute onset, and patient is not having pain. Again, she developed minimal growth, which is very soft in the starting, and after that she is not having any induration. So induration is very important here, because in cellulitis patient, everything, any patient, they will be present with all the cardinal features of the cellulitis, right? Rubor, collar, dolors, everything. Along with this, they will be having some induration. If it is the wound surrounding, there will be hardness. So this called as induration. In this patient, as the patient is having cancerous condition or any CA condition, they will be never be have induration. So in this condition, so usually you can discuss a condition called cheek carcinoma of the cheek. They will present pathology. I will discuss. First, there will be a growth, papillary growth, which is painless, non-indurated growth. After that, this growth will start spreading, like it will spread through the regional lymph nodes. After that, this growth will become a ulcer. In some patient it will form an ulcer. In some patient it will form a fissure. First, there will be painless, non-indurated growth, that papillary growth. That papillary growth become a ulcer or the fissure. This ulcer, now in this patient you can see this much ulcer she developed. So what you have to do is, this is a pathology, and only one important thing is what are the spread, how it spread. It spreads to only regional lymph nodes. You can see there are some cancerous conditions which are spreads to the example CA of the any ovary, it will metastasis or the spread to the in the spinal bones. It will spread to the spinal bones, but in these patients there is no any unregional spreads, only regional lymph node spread is there, and along with this she is having a painless now. One more thing is, What are the treatment modality? Treatment modality is only a surgical options. You should not be wait and watch here. Only direct surgeries may be recommended. And how to in first visit only how we'll discuss about like how will diagnose it is a CA patient is. You can see the ulcer shape. There will be a elevated growth here. You can see the elevated growth with cauliflower like formation of this upper lip. We can see the opened and the thick edge of the ulcer. And one important is, if it is CA, they will be having a regional lymph adenopathy. We'll check here. You can see cervical lymph nodes. She is having cervical lymph nodes here palpable. Submandibular lymph nodes also palpable. Submandibular also palpable. Here a big lymph node is there. It is a lymphoma. You can see this much of big lymph nodes. And in this side also, here she is not having any lymph nodes, but she is having lymph nodes in this area. Cervical lymph nodes, submandibular and submental lymph nodes were developed. So you can see submandibular, sublympal, any regional lymph nodes is there along with this much of the hard palpable mass. So this all clues diagnosed directly goes towards the CA of the cheek. So this CA of cheek also called as tobacco chewing CA. And there are so only treatment you should not give the drugs and should not wait and watch. You have to directly refer to the CA cancerous hospital and take the respective treatment. Thank you.